Hi, Frank.
Hello. Sorry, I was trying to work out this special system.
Fine. Hi. Can you hear me okay?
Yeah.
Yeah, good. Okay, I can hear you guys as well.
Perfect. Yeah, how is everyone doing?
Not too bad. Are we being overheard by everyone who's waiting, or is it just us at the moment?
I think we're being overheard.
Oh, okay.
Oh.
I wasn't sure.
I assumed we weren't, so it's good to check.
I think we are. I don't understand the system that well. I think we are. We're even being recorded, so let's switch off mics and stuff as well.
Okay, I'm going to turn off my video.
Right. Good afternoon, everybody. I hope you can all hear me. My name is Frank de Vogt. I'm from the University of Bristol, and I'm both chairing the inaugural symposium as well as welcoming you all to the first event of the SPHR network for the use of natural experiments in public health. So we have I think, very exciting program of two presentations by two of our own SPHR researchers and one invited presentation afterwards. Before that, though, I would like to just give everybody a bit of an idea of the network and where we are, and a little bit of what we planned, which will mostly be after the presentations. So the NIHR network has its own website, and you can go there and have a look at what we plan to do in case you haven't seen that yet. Its history is relatively short. We started in 2021, and we currently have 80 members. So we've made a very good start, I believe, showing a keen interest amongst SPHR researchers in natural experiments and how you use them and when you use them, etc. So we're very happy with this start, and many of you, I'm sure, are listening in now. So the management group consists of SPHR researchers from Bristol, the London School of Hygiene and Tropical Medicine, UCL, Imperial College London, and the University of Cambridge, and we have presentations from different institutes at this first ever symposium. The aim of the network is to raise awareness of natural experiment studies as an alternative to RCTs or standard observational designs. So we're quite interested in when can you use them, how and why, and when may they be a better alternative than any of the more standard things. To provide a forum to discuss natural experiment studies, to provide an expert forum to present and discuss methods, and the forum things are something that we hope to initiate sometime in the future, but as you may appreciate, we've only just started. And to create the infrastructure to connect, discuss methods, and discuss new natural experiment evaluations and collaborative projects, and we're quite keen to develop that more in the future. For year one, we set ourselves the task to create a management group, which you can see in the red square we have done, to establish a website, which has been done for us, and you can find it on our website, and to organize 2 meetings in year one, and this is the first of those 2, and the other one we will start organizing after the symposium, and we hope to do somewhere near the end of the year. And with a bit of luck, we can do this second meeting in a face-to-face format. Before going to this symposium, I always do this when I talk about natural experiments evaluations. Most of you have seen this paper, I hope, because I spammed everybody who applied to be a member of the network with this particular paper, and it's 4 different conceptualizations of natural experiment evaluations, and I'd like you to have a think about it, and you probably already did when you read the paper itself, because I always do a poll afterwards. So this is kind of the features, how they differ, where the first one on top left defines it as a naturally occurring event only. Dunning identifies it as an intervention that's not randomized but can be considered as if randomized. Then bottom left, Ramler and Reason think of it as a naturally occurring or planned event, but not with the specific aim of intervening in something. And then the MRC guidelines take a broader approach and consider any event or intervention for evaluation, a natural or quasi experiment. So what I wanted to do is when this is on the screen, to start a poll now, and I hope that can be done. That is a shame, because we kind of hoped that would have been set up, so that means there won't be any poll now. Hopefully we can do this at the end of the seminar. If not, then we'll leave it at that. So that brings us down to the symposium today. So this was the introduction, and unfortunately without a poll, but that's live. We then have two presentations from SPHR researchers. So first, Anthony from Imperial College, who will talk about natural experiments in tobacco control. Then Thomas from Cambridge University, who will talk about natural experiment evaluation of planning policy to regulate takeaways near schools. So also very interesting and an important contemporary problem. And then we have a recorded presentation from Vital from University of Glasgow and the MRC Social and Public Health Sciences Unit, who will talk about some of the conceptual and new work about the use of qualitative methods in natural experiment evaluations that we within SPHR places and communities have been thinking about and have recently started discussing and hopefully developing more. And Vital will tell us a bit more about what we are thinking and why and how. So I just heard that the poll is now there. So if I go back one slide, here we go. And if you click on polls, then you can go there and click on what you believe to be the best conceptualization of a natural experiment. And I'd be quite keen. I've done this in different groups, so I always like to see what people think is the best conceptualization. I'll give it. We've got 10 votes now, so hopefully slightly more people are half paying attention and can go to the poll tab and click on it. We're nearly there. I hope I can show it in a second. As usual, it's very interesting. We have about 40 votes now, so I'll show the results. Can everybody see this? Because I have no idea if this pops up somewhere. So I have no idea if anybody can see this, but so just to describe what I see at the very least. So I see 9% in definition 1, so Shady's, Cook and Campbell, 13% for the Dunning evaluation, the conceptualization, 20% for Ramler and Reason, and 58% for the much broader MRC guidelines. So this is kind of why we set up this network, because there's such a big divergence in a way and ambiguity about what natural experiment evaluations really are and how they are defined. So there's still quite a lot of work to do on this, and I hope you guys are willing to help us in the network over the next couple of years to make some methodological advancements on this. Right. Dan, thank you very much. If I go on to here's where we were. So I think this is a good moment then to move to the first presentation by Anthony. I'll stop sharing my screen and I hope he can share his screen.
Thanks. I am just going to. Sorry, I'm just trying to share my screen. Are you? Are you still sharing, Frank? I don't see the button which says I can share.
No, I'm not.
Oh, this worked more smoothly when we had a practice run. Katie, have you any screen sharing advice of this? Oh, sorry. Here we go. Here we go. Sorry, can everyone see this presentation?
Yeah.
Perfect. So apologies for the technological issues there, but I'm Anthony Lavery from Imperial, and so we're going to just talk briefly about some of the natural in tobacco control we have done. And really, I mean, to me, most of my research, within SPHR and in general, isn't about tobacco. But I think I say here that the natural experiment theme, I think, is a really good opportunity to think about and apply some of these methods. And tobacco control, I think, is a good target for these natural experimental approaches, because regardless of the conceptualization we're using in terms of what is a natural experiment, I would say there are things happening which we can assess, and there is, in the UK at least, there is good data on lots of the outcomes we might think about. And so just going to talk very briefly about two evaluations we've done. The first one was the policy in England to ban smoking in cars with children present, and the second one is around the impact of plain or standardized tobacco. Now, so our first example, so the impact of banning smoking in cars with children on secondhand smoke exposure. The reason that we are interested in children being exposed to secondhand smoke in cars is partly a denormalization effect of trying to make it so that people cannot smoke everywhere, but more importantly, inside cars, the levels of exposure can be very high because it's an enclosed space, and we also know that parent smoking, caregiver smoking can lead, or at least associated with, children taking up smoking themselves. So this is a target for policy in various places. And
Anthony,
yes?
Anthony, sorry to disrupt you. We can only see. Can you put on presenter view?
Oh, I see. I'm sorry.
Thank you.
That is, and where would I do that? Sorry, that is in slideshow. Reading views. If I do this, can you see the whole thing?
Hi Anthony, sorry, it's just Katie popping on there. If you go to the one next to that with the little book, the read view one, click on that one, that's perfect.
Perfect. All right, thank you. Sorry about that. So England and Scotland introduced the policy at slightly different times. So around about 50 months later in Scotland, providing an opportunity for a natural experiment to evaluate, does this policy actually reduce children being exposed to secondhand smoke? Now, we're not going to go through the method in detail, obviously, but suffice to say here we took two big surveys, one in England, one in Scotland, of school children, each based 2 years apart. So we're covering a 6-year period with 3 data points. And in that last data point, 2016, the policy, but it hasn't been implemented, or has only just been implemented in Scotland. So we used this measure of whether children self-reported being regularly exposed to smoking in cars. Interestingly, in Scotland, they did They did ask younger children about this, but children below the age of 13, their caregiver reported whether or not they had been exposed to smoking in cars. It wasn't a very good measure, so we made this measure in both countries, exposure inside cars. And the analysis is this classic sort of difference in difference approach, where essentially we were controlling for survey weight, age, sex, and a marker of deprivation, and we're looking at the difference between England and Scotland, and is there a difference in that difference when England implements the policy and Scotland has not implemented the policy. Now, this one graph, which if people can make it out, I think without sort of really thinking about the analysis, this one graph shows the story reasonably nicely. So in 2016 is the year when England has implemented the policy and Scotland hasn't. So no change in policy in Scotland, big change in policy. And you can see that there is this difference in our first 2 years, and then there's this big decline in England in kids reporting being exposed to secondhand smoking in cars. And so, the difference model says an absolute reduction of 4.1%, 72% relative reduction in children saying they were exposed to smoking in cars. Now, this the one thing to say about this policy is that the main aim of the policy is to reduce children being smoked on. If you Google it, you do see a lot of interesting press coverage. There was a lot of coverage at the time that says no one has been arrested for this policy, so we should abandon it. But actually, it is effective in its main aim, which is what we'd say. And interestingly, and people might pick up on this in questions, another analysis, an interrupted time series design, didn't actually say that they looked at England only, and they didn't find a statistically significant difference, but the effect sizes were the same there. So a little bit of uncertainty there, but you can look at the paper, and we submitted it to this post-implementation review of tobacco legislation, where it's cited as saying that this policy has been effective and we should keep it in force. Now, the second example, which is a little bit briefer, is the impact of standardized packaging on illicit trade in cigarettes. Now, illicit tobacco is tobacco which is counterfeited, smuggled, or evaded due taxes. And estimates vary, but the UK is losing about £2.7 billion every year in tax revenue from illicit tobacco. So it's an important potential source of revenue which is being lost, and also linked to people still smoking who otherwise would potentially not be smoking. Now, standardized packaging, plain packaging of cigarettes, as we all know, is one of the big policies. Australia started it. I think about 39 countries have implemented it now, and the tobacco industry is not keen on the idea, because it's an effective measure to stop children taking up smoking and to reduce overall smoking harm. One of the arguments that the tobacco industry uses about plain packaging is they say having plain packs will make it easier to counterfeit tobacco, and so will increase illicit trade. And this, they have obviously well-funded campaign to say this. And you can imagine that if you're in the Treasury, it's quite persuasive if someone says, if you implement this policy, there will be more crime and you'll be losing out on tax revenue. This is despite the fact that the industry is being found to be involved in the trade themselves. And also worth saying that at the end of last year, the World Trade Organization ruled finally that plain packaging is fully legal and does not compromise intellectual property. So there's a lot at stake for the tobacco industry. So we used 2 big surveys called Eurobarometer with EU 27 countries plus the UK, which asked people, have you ever been offered black market cigarettes to buy or smoke? We compared the 3 countries that implemented the policy between 2015 and 2018, so that was France, the UK and Ireland, to see was there a change of people saying they had been offered black market cigarettes. And essentially you can see we have this ordered regression making use of categorical data we have, and you can see at the top here, this is at the top is which have implemented plain packaging, and the bottom is countries which haven't implemented plain packaging, and no evidence of any significant change in people being offered illicit cigarettes after being implemented. And there's another classic difference in difference design. These are the sort of actual results. So the p-value for this difference between these changes, countries implementing, countries not implementing, is p is 0.3. And I guess both of these examples together speak to I think the potential to use natural experiments to evaluate and inform policy. And also both of these papers were actually short reports, so they were sort of 1,000 words. Some, there was some serious thinking, but each of them really only had 2 key tables and 1,000 words. So actually, quite rapid use of that data because it was available and the methods were well established. And that is it. Thanks very much for listening. I'm going to stop sharing, see if anyone has any questions.
Great, thank you very much, Anthony. That was great. Any questions for Anthony? Please put them in the chat. And while everybody's thinking about that or typing, can I just ask that one of the conditions that comes up quite a lot is the as-if randomization issue and that of conditional exchangeability. So you presented 2 examples at a national level. So what are your thoughts about as-if randomization at a national level?
Yeah, it's a good question, Frank. As if, I'm not too convinced. So I mean, so certainly if you think of that sort of smoking in cars example, the big differences between England and Scotland, at baseline, and then persist all the way through. One thing we talked about a lot in the appendix of the paper is that these are both differing contexts and different questions actually used, and so we're making the additional assumption that although these questions are different and they're self-reported, that hasn't changed over time, if that makes sense. So, but in terms of is it as if randomized, I mean, I'm open to people's opinions on whether they think that is plausible, probable, implausible. That someone should.
Well, like you, I don't know the answer to that.
Yeah.
But thanks for at the very least discussing the underlying ideas.
Yeah.
Alan has a question. Does the Eurobarometer data enable estimation changes in spending on illicit tobacco over time?
Yeah, that's a good question, Alan. So it doesn't. It doesn't have data on spending, and it doesn't. And we've got limited data on prices, and so we did have some data on prices in the model. But I mean, crucially, with illicit tobacco, as you might imagine, we don't have data on what is the price of illicit tobacco in there, and it would be good to have some actual data on what is being spent here. And the World Bank and others, they come to these big estimates. HMRC have this estimate of 2.7 billion, which is being lost in tax revenue, but it's all a little bit of a black hole, I have to say.
Thank you. We've got one long question from Hannah. I think we need to then move on after that question. How do you identify the point of intervention with something with a new start?
Yeah, that's another good question. So we were lucky in a way, certainly if you think of the smoking in cars example, because the data points are 2 years apart. So that middle one is really before there was any serious discourse about the ban, and that post data point is definitely afterwards. But in terms of standardized packaging, that is potentially, there potentially are some lead time effects. But I think with the outcomes of using illicit tobacco and exposure to secondhand smoke with children, I'm not. It's hard to think of a plausible path. Those things would be changed by announcement. But I mean, that is a good question, which could be examined.
Thank you. Before going to Tom's presentation, Sarah has a good point about the network, which I wanted to highlight. Whether there is a facility in place, which the answer is there isn't, but we hope that there will be, to, in a way, combine two populations of people with ideas for events or policy implementations to evaluate with those who know what kind of data are available. And that's one of the things we're interested in setting up, and we have to, over the next year, maybe longer, let's say the next year, we have to discuss how we're going to set that up in a kind of a practical way. All right. Thank you very much. Thanks, Anthony.
I'm going to stop.
And we'll move to Tom.
All right, here we go. Can you see my screen now?
Yes, but also not in a.
Yeah. How about now?
Yeah. Yeah.
Yeah. Perfect. Good to go. Thank you. So Frank has invited me today as a member of the network to introduce and probably do a grave disservice to, in just 10 minutes, a new evaluation of planning policy to regulate takeaway food access around schools. And importantly, I think to highlight how this work has emerged from previous SPHR funded, what we might now consider pilot work, led by researchers from Cambridge, Durham, Fuse, and LSHDM back in 2019. So I'm just going to do those two things today and do them at quite some pace. Some quick background info. And excess weight, as we all know, are leading causes of morbidity and mortality, and prevalence of poor diet and obesity in the UK and elsewhere is high, with persistent inequalities. Greater neighbourhood exposure to takeaway food outlets is increasingly considered and demonstrated by scientific research as a risk factor for those outcomes, and in fact for inequalities in those outcomes, because deprived neighbourhoods tend to have more takeaways, and there's actually some indication that neighbourhood effects are also stronger among those of low socioeconomic position. High streets, I think it's fair to say, are increasingly overwhelmed by takeaways as they've proliferated in number, especially in deprived areas. Just indicative of that, I mean, annual growth in numbers of takeaways in England was 4 times that of annual population growth from 2014 to 2018. So a quick primer now in urban planning. Urban planners have a responsibility to create neighbourhoods that enable and support healthy lifestyles. So using their existing powers, they have the ability to target takeaways specifically, and can to an extent modify this exposure as a risk factor for health. So while they can't remove permission from existing takeaways, i.e. close them down, they can refuse to grant permission to new takeaways. The decision to use the planning system in this way is, however, a local one, as planning is a local authority function, but national guidelines increasingly encourage uptake. In 2017, we were funded by SPHR to survey and document local authority planning policies targeting takeaways across all 325 local authorities in England. And I'll certainly share the slides after that has links to all of the outputs from that project. So policy documents we found included local plans and supplementary planning documents like this one from Gateshead, which contain planning policy criteria against which any new application for a takeaway food outlet will be judged. Overall, we found that of the 56 local authorities who had a policy addressing takeaways in place specifically for the benefit of public health, the most commonly adopted policy by 33 of those local authorities was what we called exclusion zones, near places for children and families. So exclusion zones are areas around schools, mostly within which new takeaways won't be allowed to open. So the precise kind of specification of the zones varied on a local authority by local authority basis. For example, they can be different sizes and shapes, centered on primary schools, secondary schools, or both, and so on. We followed up our survey by speaking to public health and planning professionals from local authorities who'd adopted a takeaway policy. And we learned, amongst other things, that although these zones were focused on schools ostensibly to address childhood obesity, to some extent this was considered a politically acceptable framing to introduce a policy that had the potential, at least, to reduce population level takeaway exposure, which might explain their kind of relative popularity in the proportion of policies that we found being exclusion zone policies. Certainly in inner London, 400-metre exclusion zones around primary and secondary schools would result in approximately 90% of the land area and an even higher percentage of the population experiencing the intervention. So in some particularly urban areas, exclusion zones are tantamount to an outright ban on new takeaway applications. So just to summarise then, I've said that 33 local authorities have adopted this intervention of an exclusion zone, the first of which to do that was back in 2019. So then the question becomes, how effective have exclusion zones been in achieving their stated aim of improving health? Well, despite a decade of adoption, the impacts of the policy are entirely unknown or at least unpublished. And this absence of evidence is a potential barrier to both implementation and further policy adoption, which is also reported by policymakers in our Qual SPHR funded work. So just a little sidetrack, because indicative of the difficulties that we know local authorities face when considering adoption of a policy like this, I saw these challenges played out in real time at the examination in public for the new London plan, which was attempting to introduce 400-metre exclusion zones around all schools in Greater London. Actually, this was a policy that was ultimately approved by the Planning Inspectorate and will soon be enforced. But in their written report, despite their decision to favour adoption, the planning committee noted in black and white that the limited evidence before them on the day regarding the effectiveness of such policies was indeed limited. And this was a point which industry representatives in the room certainly hadn't failed to make to the inspectors. On another day, the lack of such evidence might have been sufficient to stop policy adoption. And if indeed exclusion zones have been effective, any further delays stop that benefit being realised. Of course, on the other hand, we should also consider that if these policies haven't been effective, local authorities might want to refocus and not waste their resources on stuff that doesn't work. I think this front row seat to this event, if you like, steeled my resolve for an answer to this question of effectiveness. And with our learning from SPHR, this SPHR project in hand, in 2019, we applied to the National Institute for Health Research Public Health Research Programme for funding for a comprehensive multi-component evaluation of exclusion zone policies in England. So this was along with co-investigators who were involved in the original SPHR work, Jean Adams, Martin White and Steve Cummins, and a host of new faces. The full protocol should be up soon on the NIHR website. But just a disclaimer at this point, we only started in April, so I don't have any results to show you today. So as I said, for policymakers, the big question really is whether policy adoption results in better health. To observe any such impacts, presuming that it would be even possible, would require a large, long, and therefore probably very expensive study that's unlikely to be funded. But to impact health, exclusion zones would first need to change food retail. This is also, by the way, unknown, which is why we plan to observe this as the cornerstone of our evaluation. Based on that change, we'll then model health outcomes in the long term, whilst also building these health costs and benefits into an economic analysis for the local and national economy, all the while studying important aspects of implementation and acceptability, which will help us to understand how and why the intervention achieved the results that did or indeed didn't. The foundational part, of course, is our evaluation of the impacts on retail, and that is a natural experimental evaluation, and that's where I'm just going to focus the remaining few minutes of my talk. So what we're going to do is measure impacts on retail using secondary and mostly routine data from up to 2 years pre and post intervention. And we'll evaluate all 33 instances, or at least we have the ambition to evaluate all 33 instances of exclusion zone policies, a series of natural experiments, and an opportunity to generate new knowledge from existing practice. So being a retrospective analysis, uncertainty about these interventions is largely not an issue. And all importantly, before you ask, we're unaffected by COVID. We know where, when, and exactly what was adopted from our SPHR funded document review. We'll replicate exclusion zones to the precise specification adopted within each local authority. And then we'll use historic secondary data that we already hold to measure change in numbers of takeaways pre to post intervention. And Anthony's already given you a bit of background on the difference to difference method that we'll use to analyze the data. We'll use routine data from local authorities to measure change in numbers of planning applications, rejections, and appeals for new takeaways. We'll measure change in the numbers of other food and non-food retail outlets, which might be replacing takeaways within exclusion zones. And we'll also, I think importantly, and this has come out in our conversations with policymakers, we'll also measure changes on the periphery of exclusion zones, which might suggest, if we observe these, the unintended consequence of having simply displaced the problem of takeaways beyond 400 or 800 metre boundaries. We'll identify similar local authorities with no intervention to serve as our controls. This is where we're currently at with the project, trying to address important questions such as what data or metric should we use to find the best controls? Do we need to directly confirm suitability of controls by comparing pre-intervention similarity in trends in the outcomes of interest? What sensitivity analyses would prove meaningful, and so on and so forth. We'll then use difference in differences and in all likelihood a controlled interrupted time series analysis to compare pre and post trends across all schools in each intervention and control pair, and then we'll meta-analyze across all of those local authority specific effects to get what we'll call the overall intervention effect. But then importantly, we'll also look at urban, rural, and SES specific subgroup effects to try and understand the possibility that the intervention might either reduce or amplify social inequalities in takeaway exposure. So nearly done. Again, this is really just an introduction to the project, something that hopefully if you watch this space, you'll find out more about over the next couple of years as the project unfolds. I hope that today, at least, I've given the school the credit it deserves for helping the team to get to this point. And I'd certainly welcome any questions. And if you can't think of anything today, please do email me and maybe give me a follow on Twitter to hear about the project outputs and staff vacancies in due course, because we will be hiring for a number of posts over the next 3 years. So thank you very much for listening.
Great presentation. Thank you very much. A couple of questions, I think, somewhere in the thread, in the chat. One question is whether you can get a measure of prior takeaway saturation in different areas. How much can the policy actually make a difference anyway? Is 2 questions.
Oh, that's 2 questions. Yeah. So we have historic food outlet data, not just takeaways, but every part of the food retail and indeed non-food retail environment going back to almost the start of when these policies began being implemented in 2009. So we have that data. Sorry, what was the second part of your question, Frank? So I'm just struggling to read and
well, yeah, it wasn't my question.
No, of course not.
But whether the policy can actually, or is expected, I suppose, is the right question, to make a difference.
Oh, well, that is the expectation.
Well, there's no more to the sentence.
Sorry, I thought you froze it actually. No, I mean, of course, that's the expectation. Yeah, but the question will be, considering that we're not, or these policies aren't intending or able to remove takeaways, they're just able to curb numbers and flatten off the trend. I think it'll be interesting to observe within our 2-year post-intervention period whether we do actually see any fall off in numbers. And we may be able to expand that post-intervention period if we get some signal along those lines as well.
This, I'll quickly put a question in. This issue of over-provision, etc., seems very much akin to like local alcohol policies and impacts. Are you guys taking into account, say, effects of takeaways now just moving into the boundary areas of just outside of the 400-meter area?
Yeah. Yeah, absolutely. Yeah, sorry, it was rather a whistle stop, but I tried to make the point clearly, not that clearly, that we will look at the kind of areas that bound the exclusion zones, because certainly a concern among the people who are implementing this, as far as we've heard, and we'll hear more about this, is that we're just pushing the problem into that boundary area. So yeah, we'll directly be measuring that. Yeah.
Thank you. Alan had a question. If the project will be able to estimate differences in sale value from takeaways or calorie or food shipped from takeaways?
Not as planned. No, we don't have any. We don't have any purchasing data or consumption data. We will, when we model the health outcomes, we'll model the health outcomes via consumption of takeaway food. And we know how that changes in response to differences in environmental exposure. So that's the path that we'll go through to health.
Yeah. Thank you. I think we'll do one more question and then we'll move on. But just to say that Ashley has just volunteered you to present the results of next year's ASM, just so you know.
No problem. Preliminary results, actually. Not a problem.
One final question. Could there be policy resistance in terms of a potential increase in mobile units?
Yeah, absolutely. So there's lots of potential unintended consequences, and some of those we will capture in the quantitative component of this, some of which we'll leave to the subsequent work package on implementation, where we'll be speaking with people who have adopted these policies And that might be something that I anticipate they'll reflect on. Yeah.
Thank you very much. I think the other questions will have to be taken up with you outside of this session, but everybody has your email address.
Sure. Thank you very much, everyone.
Thank you. The next one is an invited talk from someone not a member of SPHR or the network. And it's a presentation by Professor Vital Katikiredi from the Social and Public Health Sciences Unit at the University of Glasgow. It's a recorded presentation, so I'll do my best to make that work. Before the presentation, there won't be any questions afterwards, because obviously Vital is not around to answer them. And he's done a lot more thinking about this issue than I have, so I don't feel comfortable answering questions either. But since it's very much a work in development, and we're only at the start of our thinking around this, any thoughts, questions, and comments appreciated. So if you could email them to me, and then I combine them all and send them on to Vital, and we can get back to you, or put these kind of things in our thinking when we develop this further. So I shall now try and do this. Hopefully it will work. There we go.
Hi everyone, it's a real pleasure to be able to speak to you today about the use of qualitative methods in natural experiment studies. I should mention that this presentation is very much a work in progress, so don't be too surprised if some of the views change over time, in particular in response to feedback as well. So today I'm going to try to give you a flavour of the different roles that I think qualitative research could contribute to natural experiment evaluations. I'm not going to go into the details of qualitative methods, which I'm not an expert on at all. And I'm going to suggest there's a few different roles that qualitative approaches can contribute, including in relation to description, to understanding heterogeneity and effect sizes, to strengthening quantitative causal claims, but also to make causal claims on the basis of qualitative data alone as well. Often when people think about the role of qualitative research and evaluation, there's a tendency to think about process evaluation. And I think the MRC guidance on process evaluation has been hugely helpful. A lot of the ideas that I'm going to mention in this talk are alluded to in this guidance, but actually I think in relation to natural experiment studies, qualitative methods could potentially go a bit further as well. So I'll try and flag up some of those potential extensions. So if we think about kind of the descriptive contributions of qualitative methods, so an obvious one is actually just describing both the theory that link an intervention to outcomes. And when I'm using the term intervention, I also include kind of broader exposures as well within that. And so one way of proceeding is to try and understand actually why might the intervention result in public health impacts, for example, through doing interviews with stakeholders. A second contribution is trying to understand actually what was the implementation of an intervention on the ground. That's not necessarily for the purposes of intervention replication, but more for actually providing a rich understanding of how was the intervention delivered, so we can better understand the role of key kind of intervention characteristics, as it were. There's also it's crucial in natural experiment studies to understand context. So that could include the drivers of why an intervention actually came about, were other interventions introduced as co-interventions, and thinking from a systems perspective, actually trying to help define a system's boundaries and the way an intervention might interact with different elements and so forth. Another important, but I would still say relatively descriptive contribution of qualitative data is to help identify the potential outcomes that should be studied within quantitative analyses. So that's a role that's sometimes taken by kind of patient and public involvement, but sometimes a more formal qualitative methods that involve kind of more clearly defined sampling and so forth to capture diverse views can be helpful. So, for example, in our work to try and understand minimum unit price of alcohol in Scotland, we interviewed a range of alcohol industry stakeholders. So, for example, producers of alcohol, retailers and so forth, as well as public health advocates and civil servants and politicians, so that we had an idea of what types of outcomes key stakeholders thought would be important to study. After something gets implemented, it's important to understand people's lived experiences as well, both because there might be key aspects of people's experiences that we don't capture with quantitative data, but also to try and understand things like behavioural responses and so forth. And another important contribution, which is still relatively descriptive, but is to try and identify potential hypotheses for effect modification. So it's possible that an intervention might, the effect size might differ across across different population groups, different contexts, but also with different effects seen depending on subtleties of exactly how the intervention was implemented and characteristics of the intervention. And we can use that information then potentially to study qualitative qualitative data to try and assess whether there's support for those hypotheses, but also to inform quantitative analyses as well. I think it's become reasonably uncontroversial now that within evaluations of public health interventions, we should try and articulate a clear theory of change for why an intervention might result in particular health impacts, and we can then use qualitative data to both look for evidence of hypothesized mechanisms, but also try and understand reasons for why an intervention might not have achieved what we were hoping it to have achieved. And that type of approach might move us from thinking about a theory of change or a logic model in quite a static way to a more iterative way, where we look at qualitative data to then refine our initial theory of change, and then subsequently we might then test that with quantitative test kind of new hypotheses with quantitative data and iterate again and so forth. So that more iterative approach to thinking about the causal mechanisms could be quite useful. So I think all of those things are probably areas which I would expect many people to already kind of suggest as important kind of contributions of qualitative data. Areas which maybe are less thought about include, for example, strengthening quantitative causal claims. So there are often key assumptions that underpin quantitative analyses of natural experiment studies. It's often important to understand the intervention allocation mechanism. So what influences whether people end up in the intervention or control group. So, for example, if we're carrying out a regression discontinuity analysis, so if, for example, there's a minimum age for drinking within a state, which then influences whether someone's likely to drink or not, and then ultimately the impact of road traffic accidents. Well, there might be other things that happen at those age cutoffs which are being used within the policy. So we can study the validity of using age as a forcing variable in that example through qualitative data. So looking at, are there co-interventions or other co-exposures? Is actually the forcing variable impacting on whether someone receives an intervention or not, and so forth. And qualitative data might also give us a sense of, did implementation actually happen as planned, and do we expect the time lags before an outcome changing to be reasonably short or potentially much longer. So as a couple of examples of how qualitative data could help us strengthen our quantitative causal claims, again, going back to minimum unit pricing of alcohol, we were interested in, are there other co-interventions that happen to have been introduced alongside the policy of interest? So we did a range of document analyses to try and build a really rich picture of alcohol policy developments in Scotland over time, and that provided some reassurance to us in that particular example. But in contrast, we were also considering evaluating a different policy called Challenge 25. So the idea was that anyone who looked under 25 would have to have a photo ID in order to be served alcohol when purchasing as a legal requirement. But there were quite a few other interventions that were introduced alongside that or closely in time, which made quantitative study impossible. So actually, it can both strengthen but also make you kind of revisit whether a quantitative evaluation is worth doing in the first place. Qualitative data can also help refine measurements of key variables. So if we're interested in especially kind of macro level variables, then the validity of many quantitative measures might actually be questionable. And we can use qualitative data to check that, are we conceptualizing things in an appropriate way, and then are the measures actually getting at what we're interested in. As an example of that, imagine you're interested in studying the health impacts of austerity policies across, say, 30 or 40 different countries. Actually, how do we measure austerity? Well, we could try and do some document analysis to look at what types of changes have happened in countries affected by austerity, and that then might inform the quantitative measures we use. You could even actually use qualitative data to help create your exposure groups, which is something I think that Niamh Fitzgerald and Frank de Vogt and others have done in relation to evaluating alcohol licensing as part of the Excellence project. Qualitative data can also help identify what confounders should be included in an analysis. So if we can develop an understanding of what drives whether someone receives an intervention or not, that can then help both identify if what confounders we should be including within our quantitative analysis, but also actually it can help give us a sense of, if there are unmeasured confounders, whether those might be particularly important or not. So I'd now like to kind of move on to the idea of using qualitative data alone. So often epidemiologists are a little bit uncomfortable with this, but if we think of the situation within a criminal court where there's a defendant on trial, it's typically often more qualitative data that is relied on to establish a causal claim within that very specific case. And within natural experiment studies, there are times when we might want to do that. So in an evaluation on a major IT investment, so the NHS England's e-health program, there's often important learning that can be developed by studying a specific natural experiment, not necessarily to provide generalizable evidence, but actually to help understand that specific implementation in detail. And there could be important lessons, especially if that particular intervention costs many millions or potentially billions of pounds. However, you can arguably create more general causal claims. So one approach for doing this is process testing, where you use a more Bayesian way of thinking about evidence to consider, well, if a piece of evidence was available, does that substantially strengthen your belief that there's a causal relationship between an intervention and outcome? Or actually, is it something that isn't particularly convincing because it's quite likely to be found anyway? So that way of thinking can lead to a few different tests that can be based on both qualitative and quantitative data. And an example of that has been used by Miriam Alvarado in her evaluation of the sugar-sweetened beverage tax in Barbados, where the finding of some things is much more convincing in strengthening a causal claim than the finding of others. So the strength of this approach is not just in being able to make a causal claim or not, but also helping identify where along the process, in terms of causal mechanisms between the intervention and the outcome, where is the weakest evidence and what is needed to strengthen that. So often in the contribution of qualitative data in relation to establishing cause and effect is more about strengthening the causal claim or potentially disproving the causal claim rather than in actually estimating an effect size. And it could be particularly valuable in relation to complex systems. So if we were interested, for example, in what was the impact of the Framework Convention on Tobacco Control on broader tobacco policies and helping facilitate system change in terms of tobacco control, then this type of more qualitative approach to natural experiment thinking could be really valuable. There's a range of methods available, a few examples there, but an important thing that's worth noting is that when we're making claims from these types of evaluations, it's often based on our theoretical understanding rather than any kind of claim about statistical representativeness. One potential concern, so while I certainly think there's a role for more use of qualitative data, I'm not, that there certainly are potential risks, and they include issues around the transparency of some of these approaches, and the potential influence of vested interests goes alongside that lack of transparency. So to wrap up, qualitative research can play a really valuable part of natural experiment studies. There's multiple roles, and I suggested that some of these roles are probably being underutilized at the moment, and what we really need in public health are good exemplars and greater expertise. So I'd just like to finish by thanking my funders, but also Frank for inviting me today and for useful discussions on this. Thanks very much.
Right, thank you very much. So this was the last presentation. I'm a terrible chair because I managed to run over time with a pre-recorded presentation, I'm afraid. I just had, let me see one. There we go. Two final slides. Just to say, before we go to the final thing, if you have any questions, comments, or suggestions about Vital's work, then either email him or email me, and I'll collate it all and send it to him so that we can sharpen up our thinking on this. There were more people attending the session than there were network members, so that's always great. So if you're interested in joining, please email me directly and I'll add you to the list. The network is also open to non-SPHR members. So, so if you have colleagues or friends who would be interested, don't hesitate and have them email me as well. And then the final thing for me to say is that we aim to organize a second meeting at the end of the year, hopefully face-to-face. We don't know when it is yet, but we'll start thinking about that soon. And we welcome any thoughts, comments, and suggestions on this meeting, but also on what you think would be a good idea for the future meeting, so that we can take all that into account. And I've already seen 1 or 2 comments about this, which I'll take with me to our next management group meeting. But yeah, don't hesitate to contact me about this. So thank you very much, everybody. I hope you enjoyed this as much as I did. And I believe this is the end of this year's SPHR ASM. So I hope to see you all soon, ideally face-to-face. Thank you very much. Bye-bye.